Hi friends, I'm Priya Mistry, the TMJ Doc. This video is about selective serotonin receptor inhibitors, SSRI drugs, and how these medications can exacerbate TMJ disorders. SSRIs are very commonly prescribed drugs that are used as antidepressants in anxiety disorders, major depressive disorder, and other psychological conditions. According to an article from Harvard Health Publishing, 1 in every 10 Americans takes an antidepressant. That's 10% of us Americans. 23% of women in their 40s or 50s take antidepressants. That's a higher percentage than any other group by age or gender. For those of you who don't know me, I'm a general dentist with a practice in beautiful Portland, Oregon, where I work with my mentor, Dr. Arthur L. Parker. If you haven't already, please be sure to check out my Instagram handle. I post here quite frequently, probably 3 or 4 times a week, with a lot of information on TMJD. So please check it out if you like to nerd out on TMJ information like I do. So let's get right into it. So I want to start out by saying that SSRI medications can be truly wonderful and life-changing for people who suffer from depression or anxiety disorders. I've even taken Lexapro myself, and it's helped me a lot when I had anxiety. When I was taking Lexapro, I couldn't even muster up anxiety or anger, and my husband, he can attest to that. So it can be incredibly beneficial. So I'm not making this video to bash any type of medication or anything like that. I'm just trying to put more information out there. Common brand name SSRIs are Zoloft, Paxil, Prozac, Lexapro, and Celexa. So if you're taking any of these medications or you've heard about them, watch this video until the end to learn more. So having said some good things about SSRIs, I also want to point out that SSRIs are linked to increased clenching and or bruxing activity. Clenching and bruxing activity can be 80 to 100 times or more, even more than that, forceful than regular chewing forces. So think about that. Think about taking like a hard candy and biting into it. That's considered a regular chewing force. Multiply that by 100. Multiply that by 200, multiply that by 80, whatever it may be. Our teeth are not built to withstand that kind of force. And that kind of force can cause our teeth to fracture. In our entire lifetime, our teeth should not break. Enamel is literally harder than bone. So imagine how much force is going into your teeth if you're somebody who's had multiple teeth crack, you've needed root canals, you've needed crowns because of that. For some people, it's totally normal to crack a tooth or get a root canal or a crown every single year. I'm here to tell you that's not normal, and I've seen way more cracked teeth since the start of COVID than I have at any other time in my career, and I've been doing this for 13 years. Our teeth should last a lifetime without cracking if they're used for chewing and speaking only, and not for what we call parafunctional activities like clenching and or bruxing or grinding the teeth. So how does this even make sense? Doesn't it seem paradoxical to you that an anti-anxiety drug can cause more clenching and grinding activity when clenching and grinding is linked to stress? Well, I wish I had a good answer for you. I'm not entirely sure why these drugs are linked to increased clenching and bruxing activity. What I can tell you is that this side effect is more common in women. I can also tell you that studies show that increased clenching or bruxing activity starts within 3 to 4 weeks of starting the SSRI medication, and it's been shown to decrease 3 to 4 weeks after stopping or discontinuing that SSRI medication. The problem with this increased clenching and bruxing activity is not only that it can crack teeth, which is a big problem in and of itself, but it'll exhaust and fatigue the muscles that surround and support the jaw, leading to headaches, neck pain, jaw pain, ear pain. It can even cause the jaw to lock. So I want to be very clear that I'm not asking you to stop taking your SSRI medication. I'm just asking you to be cognizant or aware of the side effects that it can cause, and then just make the decision that's best for you. And of course, keep in mind that not all side effects affect every single person taking that medication. So not all the people that take SSRIs are going to have that increased clenching or bruxing activity. So that's really it, my friends. If you like what you heard, if you learned something new, click like below, subscribe to my channel, do all the things, make sure you ask any questions, make comments, do what you must in the comment box, and I'll be sure to answer. And remember, you can never have TMI about TMJ. Thank you.